If you're a lifter who's been dealing with back pain and you found yourself thinking, I should probably get an MRI for this, then this video is for you. Most lifters that have back pain think that they need an MRI to figure out what's going on and what the best way to manage or treat their back pain is, whether that's due to things they read on the internet, things that they hear from other lifters, or things that fellow healthcare practitioners tell them. In most cases of back pain, an MRI actually isn't the best thing to get. So in today's video, we're going to discuss why that's the case, and we also will discuss when an MRI is warranted. But first, make sure to like and subscribe to this channel so you can learn more about pain, injuries, and the rehab process. Overall, there are 3 big reasons why an MRI is not needed in most cases of back pain. Those points are: 1, the findings of an MRI often don't correlate all that well with somebody's pain. 2, in many cases, the findings of an MRI don't actually dictate what the best way to treat somebody's back pain is. And 3, getting an MRI early in somebody's back pain experience can actually lead to worse outcomes and increased costs. Many of the things that we see in MRI that sound bad and sound scary and people think are the cause of their back pain, such as disc bulges, disc herniations, degeneration, facet joint changes, and other things, are actually often very commonly found in people who don't have any back pain as well. And we've also now come to realize that many of these changes are just normal age-related changes that happen in the spine as we age. Brinjikji et al. In 2015 did a systematic review of studies that looked at a total of over 3,000 people who had no type of back pain whatsoever, and they looked at their MRI results. What they found is that many of these changes are present in people who have no back pain whatsoever, and pretty much all of them tend to increase in prevalence as we age, which means they just get more common as we get older. For example, disc degeneration was found in 37% of people in their 20s, all the way up to 96% of people in their 80s, and it increased in prevalence with every decade of life. Similarly, disc bulges were found in 30% of people in their 20s, and 84% of people in their 80s, also increasing with each decade of life. Further, how often these findings were found in people who had no back pain is very similar to the number of times that we find in people who do have back pain. So because of that, the MRI results by themselves are not that well correlated with pain. And in order to actually correlate an MRI finding with somebody's actual pain experience, we need to match it with their clinical symptoms. Overall, this review shows that a lot of these changes are found in totally pain-free people. They increase in prevalence as we age, and they're found just as often in people without pain as people with back pain. So because of that, the MRI findings often aren't that useful in determining somebody's actual pain. The next point is the findings on MRI often don't dictate what we should do to help resolve somebody's pain, because everybody's pain or injury is unique to their specific situations. All that an MRI does, it gives us a picture of the inside structure of the spine, and it doesn't tell us anything about your flexibility, strength, stability, training history, how good your sleep and nutrition are, what your other life stresses are, and all these other things that play such a big part in somebody's pain experience. For example, 2 people could have pretty much the same exact findings on an MRI, but have very different circumstances. One might be a more sedentary individual who's not doing a ton of training, and the other might be a competitive powerlifter or Olympic weightlifter, and those 2 people should be treated quite differently, and the rehab plans for those people should be quite different. So just because they have the same findings in MRI, that doesn't mean that they should be doing the same thing. The rehab plan and overall plan of care should be tailored specifically to those people's needs for their specific contexts. When it comes down to determining the best sort of rehab plan or rehab approach for somebody who's dealing with back pain, the much more important factors are what their current pain is like and their current symptoms and deficits, such as range of motion, strength, stability, and endurance, and what their goals are. Knowing these 2 things really gives us the roadmap for how we should approach that person's rehab plan, and that's what's going to dictate their treatment a lot more than just what their MRI says. And the final point for why MRIs are often not necessary for back pain to either know what's going on or how best to treat it is because MRIs can often lead to worse outcomes, and they can be quite costly. This study by Webster et al. In 2013 actually looked at people who got MRIs early on in their care for back pain versus people who didn't, and looked at how well they did and what sort of expenses that they incurred along the way. What they ultimately found is that getting an MRI earlier on in the process, within 30 days of the onset of pain, led to higher rates of disability, higher rates of surgery, and increased healthcare costs without any improvement in outcomes. One of the reasons why this is the case is because so many of those things that are found in MRIs are found in people who have no pain whatsoever and may just be what we call an incidental finding, which is something that we just happen to see on the MRI that's not actually causing any issue or any big part in that person's pain. And when you see these incidental findings, one, they sound quite scary, so they provoke a lot of fear and anxiety in the people who get these MRIs done, and they are at risk of over-medicalization or over-treatment. So they get these unnecessary injections and surgeries for things that are found on the MRI that might not actually be contributing to or causing the pain. So overall, MRIs are often not necessary or not even helpful in figuring out what's going on with somebody's back pain or what the best course of care is, but there are absolutely times when an MRI is needed. The two cases in which MRIs are very helpful or actually needed for somebody is either when there are red flag signs or symptoms or when surgery is being heavily considered. Red flag signs and symptoms are things that people with back pain experience or that they might report to their healthcare provider or that the healthcare provider will see on an examination that suggests that something a lot more serious could be going on, such as an infection, fracture, or cancer. Some of these red flag signs and symptoms when it comes to back pain are things like severe progressive neurologic symptoms such as loss of strength or feeling in the leg, history of cancer, unexplained weight loss, loss of bowel and bladder control, fever coinciding with the back pain, and things such as trauma with a fracture suspicion, especially in those people who are older. When these signs and symptoms are present, it might mean that something a lot more serious is going on, that physical therapy or exercise or more conservative care is not the right thing for, and those absolutely would suggest that an MRI or more advanced medical imaging is the right thing to do. So overall, most lifters who have back pain do not need an MRI. The scans or findings that are found on an MRI often don't match with somebody's pain and aren't the cause of the pain. Early imaging can lead to unnecessary treatment concerns and financial burden, and imaging is most helpful or really only helpful when red flag signs or symptoms are present or somebody is really strongly considering surgery. That being said, if a case of back pain is ever very concerning or anything like that, it is always best to consult with a trusted healthcare provider such as a physician or primary care provider to see what should be done in that case.